I'm very interested in men's health, and I'm here with Dr. Carl Postighone. Did I say that right?
That's correct.
Okay, men's health. Dr. Carl is a board-certified internist in Associates for Internal Medicine, and he's a fellow in the American College of Physicians, and has practiced alongside Dr. Martin Pontecorvo.
Correct.
Hey, how about that?
Very impressive, Steve.
Thank you. In your practice for over 20 years now.
Yes, getting old.
Very good. Yeah, a lot of that going
remind me all the time.
A lot of that going around. Anyway, you deliver comprehensive health care at the Sterling and Florham Park community, and you're going to be here at this facility as well, on and off.
Correct. My partner and I, we flip-flop every day, and so we're here 6 days a week.
And we're talking about men's health. June is Men's Health. You didn't know that. I didn't know that. Now we all know that. June is Men's Health Month. And what are your top tips for men to get and stay healthy? And I'm really into this. We were talking earlier, but I'm just going to let you go.
Steve, thanks very much for having me on. I really appreciate it.
It's great to have you.
And I think one of the things that we always try to focus on when it comes to men's health is the fact that men traditionally will not seek medical attention. As we know from most health studies,
they put it off.
Correct, absolutely. Women traditionally will be on the forefront of seeking care, and obviously the women always make the health appointments.
Mm-hmm.
When we talk to men, we always say, listen, set realistic goals. Don't go out there like gangbusters. Don't be that weekend warrior. When you're going to start to embark on a good health program, set these goals that you can accomplish. One of the things we always try and get people to attain is 30 minutes of continuous activity every day.
Right, okay.
But oftentimes patients just can't go out and start doing 30 minutes every day with it. So even if it comes out to starting off at 5 minutes a day, and then try and build up 1-2 minutes, once every week, and then try and prorate that up and hopefully accomplish 30 minutes every day.
Dr. Postighone, you look in great health, great shape. Now, what is your routine? What is your regimen?
So I try and work out at minimum 5 days a week. I'll go to the gym. I try and do a hybrid of 15 to 20 minutes on a stationary bike or a treadmill every day, and then combine that with some type of free weights or isometric training with that. And I think that's where we try to balance exercising now, either do a combination of it or try not to just focus on just one type of exercise. Because what happens is we see as we get a little bit older, we get these overuse injuries.
Overuse, they start out too hard thinking that they're young again.
Correct.
So they go back out there saying, I can do 40 or 50 of those, or I can do that mile in 7.5, 8 minutes.
Correct.
And you're going to hurt yourself. So it's something like that. So that was where we also start going into the preventative measures that you also can deal with here at the facility.
Right.
And what are some of those?
So one of the things that we do try and focus on is preventive health care, such as colonoscopy, blood pressure check, cholesterol check, PSA testing, smoking cessation. I think those are the big things that we really try and focus on.
Yes.
The other things that we try and focus on are things that a lot of men don't really address or trying to think about: skin cancer prevention and depression. So all these things are
depression can ultimately with men leads to other things.
Absolutely.
Different than from women.
Absolutely. Upwards of 40% of men do suffer from depression. And a lot of times men won't address it. They kind of hide it down below their hard shell.
Right. Oh, that's tough. I'm not going to admit anything like that. But getting healthy not only improves your own health, but your own family and your environment and your neighbors, your community's health. So it's very important for the men to take care of themselves.
Absolutely. And your sense of well-being actually emanates that to across the board from everybody, not only, as you said, your family, but also your job.
Right. And, I started earlier. I had a pretty good regimen for years. I played baseball, and then I was doing taekwondo with my son and this, that, and the other, and I had a little issue with the heart. Yeah. And I now have the Fitbit. What do you think about these things, the Garmin's, the Fitbit, for folks to at least monitor what they're doing and to give them some type of maybe impetus to do some extra work all the time? I'm working with my friends and neighbors on my cell phone, and I can see, and we're all competing against each other, especially the guys.
Right.
Who never did anything before.
Right. I think they're a great tool for people. For some people, they work great. For other people, they don't. Some people get very confused with it. Mm-hmm. So for someone like you, it sounds like it's a great tool.
But they always say, see your physician first before you do any of these programs. And at this facility, you'll be here along with your partner, Dr. Pontecorvo.
Correct. Absolutely. Because you just want to make sure your baseline is healthy for you. Someone like yourself also who may have an underlying health issue, we want to make sure that you're on the right track.
That's correct. Thanks so much, Doctor. Anything else?
Nope. We're great. Thank you very much.
Thanks so much for sharing with us. And June is Men's Health Month. And, just make sure that you take care of yourself, guys.